Hello, my name is Dr. Kim. Today I will be talking about Morton's neuroma. So Morton's neuroma is also known as interdigital neuroma or neuritis. It's a common manifestation that occurs in the foot, and the presentation is usually a sharp pain, numbness, tingling, and the most common area is the third inner space, which is between the third and fourth toes. Now, neuromas commonly occur from irritation, mechanical trauma, tight shoe wear, as well as high impact activities such as running. The predisposition to developing a neuroma really occurs anatomically because you have a branch from the lateral plantar nerve and the medial plantar nerve, and they both contribute to make the interdigital nerve for the third inner space. So anatomically, it's already bigger. With mechanical trauma, this can cause fibrosis, scarring, and thickening of that nerve, which eventually develops into a Morton's neuroma. The third inner space is the most common site of a Morton's neuroma, but the second most common site is the second inner space, which is the toe space between the second and third toes. Aside from the anatomic explanation of why a neuroma occurs, it also occurs mechanically. If you look at the foot, there's a lot of motion that occurs between the third and fourth toes because of the mechanical articulation of the lateral and the medial columns of the foot. Other causes of neuromas could be ganglion cysts, it could be a tight Achilles, or gastrocnemius equinus, and as well as activities such as ballet dancers can get neuromas in their foot from just repetitive microtrauma. Common symptoms include burning, tingling, sharp pain at the bottom aspect of the foot, and pain can be intermittent and activity related. Conservative treatment includes activity modifications, wide toe box shoes, metatarsal pads, also known as neuroma pads, and physical therapy. If those conservative measures fail, I would suggest getting an evaluation by an orthopedic foot and ankle specialist to evaluate your Morton's neuroma. Typically, an examination is accompanied with x-rays, and sometimes if those conservative measures have failed, we can talk about the next step, which is a cortisone injection. A cortisone injection can treat a Morton's neuroma and completely alleviate the symptoms up to about 15% of the times. Operative treatment for a Morton's neuroma is surgical excision. Usually, this is reserved for patients who have failed at least 6 months of conservative care. My approach to a Morton's neuroma is a clinical examination followed by radiographs and physical therapy, and we can discuss orthotics, as well as metatarsal pads, medications such as gabapentin lyrica, physical therapy, and possibly a cortisone injection. Before surgery, it is a good idea to obtain an MRI to, one, ensure that you have a neuroma, as well as localize the neuroma, because again, it could either be in the third or second inner space. Also, you want to look for other possible causes, such as a plantar plate tear or a ganglion cyst. Excising the nerve, people always ask, what am I going to feel? Well, you will have numbness between the third and fourth toes, but the digital sensation will not be completely gone because you'll still have the dorsal nerve roots that are innervating the digit. So it's really that inner space, when you rub the toes between, that's the numbness I have after you resect a nerve. A Morton's neuroma excision is usually approached dorsally. Why? Because the plantar area is pretty sensitive and you do not want to get a postoperative wound infection. And for me personally, I do reserve a plantar approach with an incision on the bottom of the foot for any revision procedures if need be. Complications from surgery include infection, bleeding, nerve damage, but in this case we are excising a nerve, so one of the complications you have to worry about is a recurrent or stump neuroma. The postoperative course is pretty straightforward. For the first 2 weeks, you are either in a surgical walking boot or a surgical postoperative shoe, and as long as you wear those devices, you can weight bear as tolerated. At 2 weeks, if the incision has healed, we'll progress you into athletic shoes, albeit if the swelling is too much, you might have to wait on that, and then we do start physical therapy. Majority of patients get back to full activity usually between 6 to 12 weeks, and the success rate of a Morton's neuroma excision is 80 to 90%. Well, thank you for joining me today on a discussion about Morton's neuroma. For more information, please visit my website, drpaulkim.org. Well, thank you for joining me, and I definitely look forward to seeing you next time.